I'm sorry if I'm breaking the queue. Shruti has a course, so she would be presenting. And what's your
So, judges, please note this is Dr. Shruti at number 10. She's presenting on LUMINO sundial, a device to prevent myopia progression.
Shruti's name in your marking list? Okay. Okay. So I would be obliged. Who is the discussant in that? It's not mentioned in the final paper which we just got now. Dr. Madhukar, can you take care of it?
Thank you so much for considering me. I had another inspection course, so I appreciate being pushed. Sorry about the inconvenience. So this is a beautiful view of a scenery, but imagine if you're viewing the world like this. Now, this is myopia, the inconvenient truth, and 50% of the world is actually going to be seeing the world blurry by 2050. Now, if you think it's just the world, imagine in India, there is studies that indicate that by 2050, we are going to have almost 50% of our Indian population becoming myopic. So the problem is serious, but the solution is simple, and it is sunlight. There are several studies on sunlight that show that there's a preventive and a protective effect of sunlight just by 2 hours a day. But the problem lies in that we don't know what are the protective factors in outdoors. Is it the sunlight? Is it looking far? Is it the outdoors? And our question is the only way, like they are limiting factor because they just have recall value but no objective measurement. And the third is, how can we promote outdoor activity to the parent and child? Now, to answer all of these questions, we innovated with a new device called the LUMINO sundial. Now, this is a device which has a dynamic sunlight monitoring in the child. It can be worn on the wrist and on the ID card, and it has a ambient light sensor on the top, as you can see here, and this light sensor picks up the sunlight measurement of the child on a dynamic basis. Now, what is the kind of data that we can harvest from this? The illuminance levels based on the lux, the UV exposure, the UV index, the infrared exposure, the physical activity in terms of steps or accelerometer, the heart rate of the child, the ambient temperature that the child is being exposed to, and using all this, we created an algorithm to calculate the overall outdoor time. So here, every measurement is taken every 5 seconds and computed so that 1 hour, 60 readings are taken to give the average sunlight exposure of the child. Now, this data is fed into a mobile phone application that the parent can actually see real time and see how much of exposure the child is actually having throughout the day. And most parents are working, so they would really appreciate this, and they can actually set goals for their child as well. The first step of the study was to validate the device against a standard luxometer, and we saw the reliability of 0.7, which is good. We also compared the different settings of the device: outdoor sunlight, outdoor shade, indoor natural illumination, and indoor artificial light. We found statistically significant difference between all the 4 situations. We also found that outdoor shade and indoor natural illumination showed a little bit of similar readings. So sitting next to a window is probably really good for the child, as equal to sitting under a canopy. We also found that 1000 lux is considered arbitrarily as outside and inside. But in our readings, we found even outdoors was less than 1000 and indoors were more than 1000 in some settings. So we decided we needed more reliable readings for this, and we put all of the information that we had collected from the devices into machine learning. And using AI, we had found an accuracy of 67%. So now the device is loaded with real-time data. We then went ahead and did a 1-week compliance study and wearability study, and we found compliance of 83%, and feedback was excellent, and the time spent outdoors was 1.2 hours in the holidays and 38 minutes in the school days. Now, following this, we also did almost 1 month study, and here if you look at this, the average UV exposure of 10 children was 0.65 indoors, whereas it was 4 almost outdoors. So the learnings from our study was that we validated it. We found UV is a better predictor. Standing near a window is similar to standing under a canopy, and device can predict 93.7%. We also now currently having European studies in parallel with the Erasmus group in Rotterdam to see how the climate change actually affects the device's readings. So to put it in a nutshell, LUMINO sundial is a reliable measurement of sunlight exposure. It can be a pivotal research tool, and it actually helps the clinician to customize myopia control for each child. And it is actually a good feedback mechanism for the parent and child to promote. Thank you so much. This is me when I was a child, and these are my children today sitting in front of the laptop. I think we need to change this paradigm today. Thank you so much.
Wonderful. Dr. Madhukar?
Yeah, I think that's a great tool to know what's happening. And as of now, we don't know what are the factors
sir.
which are promoting myopia.
Yes, sir.
And it's a wonderful study, and congratulations.
Thank you, sir. Thank you.
Dr. Shruti, have you applied for a patent or anything like that?
Yes, madam. So as we speak, yesterday was the hearing of the patent, and the result would come in a few days. But we have applied for the patent.
When you apply for the patent, can you present it elsewhere? I don't know, yesterday in the hall, there was a discussion that when you apply for something,
So it's pending.
Patent
She
is
can
pending.
accept. She can present it. And she owns the patent, so she can still present it. Very powerful last slide.
yes, very
Thank you so much.
So we want the discussion.
Thank you for considering again. Thank you.